Hello and welcome to this conversational blog on International Women's Day 2021 with the theme of challenging. And we 4Women have been working to challenge the stigma and discrimination surrounding mental health issues all over the world, but particularly as part of the Time to Change programme, which is how we met. All of us met that way. We've been working to address mental health stigma and discrimination affecting women and men, particularly in the UK and more recently in Africa and India, and particularly in Ghana, which is how we met Essie, how I met wonderful champions Essie and Cecilia, and also through this programme, how I met the wonderful Diane. So we're all women with lived experience of mental health issues. Each one of us lives with mental health issues, and we're going to ask each other a series of questions as part of this day to challenge stereotypes, and we want to challenge mental health, prejudice and discrimination. So I'm going to ask everybody to introduce themselves, and then I'll introduce myself and we'll get going with our questions. So Essie, Cecilia, Diane, in that order, could you introduce yourselves, please?
Okay, so my name is Esenamdra. I live in Ghana and I'm the project coordinator for Mental Health Society of Ghana. I'm a former champion for Time to Change.
Thank you.
Thank you.
My name is Cecilia, Fofo Ashaley. I also do work with BasicNeeds Ghana as a program assistant, and also a proud champion of Time to Change. I also live with a condition called bipolar affective disorder. Thank you.
Thank you, Cecilia.
My name's Diane Kingston. I'm a global technical lead on disability inclusion and mainstreaming with the organisation Sightsavers based in the UK. And we have a lovely project that I'm part of in Ghana, which I'll speak about later.
And I'm Sue Baker. Until recently, I was the director of Time to Change Global, which was a 2.5-year project to tackle mental health stigma and discrimination in 4 locations in East and West Africa, including Ghana, and in southern India in rural Dodabalapur. The origins of the work were from the anti-stigma and discrimination programme called Time to Change, running in England for the last 15 years, which sadly too is coming to a close at the end of March. But our work is all about building up the confidence and skills of those of us with mental health problems to tackle stigma, and for our NGO partners and communities to do the same. And what we're going to do is explore the impact of stigma and discrimination on our lives and how we're working as women, as many women around the world are, to tackle these outdated and damaging stereotypes. So without further ado, I think we're going to get into the interviews. We're going to take it in turns to sort of interview each other. So my first question is to Cecilia, who you have given so many standout testimonies, so many places where you've told your story. So as today's theme for International Women's Day is about choosing to challenge, and we're challenging mental health stigma, what motivated you to do the amazing work that you've been doing to tackle stigma and discrimination in Ghana?
Thank you so much, Sue. I would say that being diagnosed with a mental health condition gave me a different idea when it comes to mental health challenges. And I realized that there is so much to do in terms of combating stigma and discrimination attached to persons living with the condition. So I decided to join the team in fighting this noble cause. So being diagnosed is one that motivated me, and as well as support groups that I have, organizations that I joined, for example, Time to Change Global, as well as my organization I'm in now, that's BasicNeeds Ghana. it all has enlightened me so much as to the work that is still at hand for us to do to challenge stigma attached to persons living with mental health conditions.
Thank you, Cecilia. And can I just ask as well, as part of your experience of stigma, you've been sharing your story at events across Accra. You've also been doing some media work and some speaking, but you also featured in the social marketing campaign in Accra, sharing your story. And I remember you very powerfully saying the impact of stigma and what it had done to your life. Could you just share with us what happened when it became known that you had a mental health issue?
Exactly. So I'll summarize it. First of all, it started with my work, my formal work, which I was a school teacher at a private school. Upon knowing that I have a mental health condition, they felt I was endangered to the children. So they asked me to go home and then take care of myself. So that is in terms of my work. And then in terms of my community, those around, living around, they started pointing fingers. Others even said that if they were my husband, they would have left me, which were very stubborn words. And even down to my very close friends, some even called me names like I'm cursed. So the stigma is really real, and it goes a long way more than just the human eye. Emotionally, it brings you down when you hear all these things. People around you who are supposed to support you, and you're getting this feedback from them, is really bad. So upon knowing that there's an opportunity to turn tables around, I quickly took that opportunity.
Thank you for sharing that, Cecilia. Thank you.
Thank you too.
You're going to ask the next question now.
So the next question I would love to ask, AC, hello. So I would want to know, AC, with all this going on, how has this affected you as a woman in Ghana? And we know you're a young woman who also has mental health issues. So how has this affected you in terms of being undermined as a worker? I know you're a YouTuber, all these areas. How has this affected you?
Okay, so I got diagnosed with a mental health condition called bipolar disorder in 2015. So I have been living well and managing my condition until 2019, when I decided to disclose to my boss that I had a mental health condition. I was fired. So in the school I was working in, the stress levels were very, very high. And I thought confiding in my boss, because she was a foreign boss, I thought, oh, maybe foreigners will be more understanding and accepting, because I know there's a lot of stigma in here. So I wasn't expecting a foreigner to stigmatize me because of my mental health condition. So within like even less than 24 hours, she told the rest of the members of management at the school I was working at that, oh, I have a mental health condition. I was regarded as violent, unpredictable, dangerous, and that was my last day working at the school. And so when it comes to stigma in Ghana, it's very, very real. People don't realize that mental health conditions are like physical conditions. And I always try to see that probably if they found out that I had diabetes or maybe hypertension, I wouldn't have been fired. But because I said I have a mental health condition, that's where everybody is afraid. And most of the time, people stigmatize here because of ignorance. There's not much education about mental health over here. And that's why I decided to use my channel, All Things Bipolar Disorder, on YouTube. I started a channel last year in March to create awareness about mental health. I do not only talk about bipolar disorder, but I discuss other things, even depression with men, so that it covers all areas, and more people will get to know that mental health conditions are very real. And I do believe that even if people don't watch the videos today, those videos will be there for time to come, and it will help the greater good. Yes, thank you. Okay, so it's my Yeah, so my question goes to Diane. Diane, are you there?
Yeah.
Yeah, so Diane, I just want to ask you, how do you think the negative stereotypes of mental health issues impact women?
Yeah, that's a really good question, Essie. And actually, it's kind of like two questions in one, because negative stereotypes of mental health is one aspect. And then you also have negative gender stereotypes. Yeah. So, for example, women have been disproportionately affected by gender-based violence, especially if they don't conform to what's expected of them as a woman and as a mother. And in turn, this violence can affect their mental health. So stereotypes, when you have them combined, mental health stereotypes and gender stereotypes that are both negative and harmful combined, that's a really potent mixture. So at Sightsavers, I'm part of a team that supports the delivery of a UK aid-funded programme on disability, and it has a particular focus on mental health in Ghana. So indirectly, I work with both Cecilia and Essie on this. And a big part of this programme, you know, is about challenging social norms, what's okay and what isn't okay. And it's a significant part of the programme. Why? Well, social norms in the UK, for example, stemming from Victorian times, like long time ago, women could be categorised as mad or sad or bad if they didn't conform to their gender norms then. And women's mental health has often been joined to their hormones. And we know that this is really problematic, yeah? So women as child bearers and predominantly as child carers, women with mental health conditions are often seen, as you've mentioned, Cecilia, as cursed or associated with bad spirits, both of which are really negative and wrong stereotypes. But I also want to just touch on the major issue of legal capacity. And when that's muddled up with mental capacity, what actually happens. So this affects women in a range of different ways that doesn't affect men. So it affects women in as much as if women have a mental health condition and they're living in an institution, they might be forcibly sterilised. They may have the custody of their children taken away from them because they're seen as an unfit mother. You have an unsound mind, so you must be an unfit mother. You might have your property ownership taken away from you, and you might not be able to choose where and with whom you live. So I want to come back to you, Cecilia, and ask you how you've been tackling mental health stigma, this really harmful negative stereotypes, and how has this impacted on your life? You've given us a little bit of a taster there, but if you have anything more to add, that would be great.
Yes, so in addition to that, being an advocate for mental health, it also gives me the opportunity to participate in various advocacy programs that are in connection to tackling the stigma. For example, I had the opportunity to be part of the Time to Change Global team to at least do a face-to-face conversations to change attitudes and behaviors of persons without mental health condition towards those with mental health conditions, as well as Facebook Live sessions where we also tackle the same stigma reduction and discriminatory attitude on the Facebook Live sessions. In addition to that, we also move into our communities to change lives. I personally do that in my community, which has helped a lot. In addition to that, I have been given opportunity to speak on radio stations, TV stations in the same directions. Example, sometimes also on suicide, which is also related to mental health conditions. So all these areas are the channels. And then particularly or presently, being part of Basic Needs Ghana, a team that is into influencing policies with regards to persons with mental health conditions, trying as much as possible to make their lives a better one, for them to access their basic rights and their basic needs. This has also helped me to know that I'm in the right direction to challenging this stigma. Also, personally, from being part of the Time to Change program now, some of those in my communities now have a different attitude. So I would say, even if you've not been able to change the mindset nationally, on my part, my friends, some of them have a different attitude towards mental health conditions, to the extent that one of my friends, the mother called me to let me know that the son also is going through a similar condition. What can they do? I said, this is heading towards the right direction. Means they know that if you have a mental health condition, that is not the end of your life. You can get help, you can get better. So not being a professional psychiatrist or a psychologist, I direct them to the various psychiatric hospitals that we have, as well as others who have come to me for help, and I direct them to the various necessary professionals, the various professionals in terms of that. So I think this is really going to the right direction, and I'm happy to be part of it. In addition to that, being a programs assistant at Basic Needs, I also get the opportunity to participate in different projects. For example, the Ghana Somubi Dwumadie, the maternal mental health, all those things are channeled to persons living with mental health conditions, which is a great idea. And I'm very happy to be part of that programs. So with that being said, okay, so yes, I think Sue.
Yes, I'm ready. I think you've got a question for me.
Yes, but the question is, all right, so if I may ask, what are the best possible ways forward in terms of challenging stigma and discrimination? What do you think are the best possible ways forward?
Thank you, Cecilia, and thanks for all that you've been doing on stigma and SC2 in Ghana. You've been doing incredible work. You've inspired other women and men to do similar work. And I think that's what it's all about. It's about those of us with lived experience, wherever we are in the world, being supported and sharing our stories, because it's what we found is that in different contexts, whether that's UK, Ghana, Nigeria, Kenya, Uganda, Southern India, and many other campaigns that I know around the world, one of the things that really works is when those of us with lived experience speak out. And we put a human face on an issue that people don't understand, and people either think we're mad, bad, sad, and dangerous to know, just like you and Essie experienced when you lost your jobs, or they just, think our lives are over and we're thrown on the scrap heap. So, we need to speak out to change those stereotypes. We're human beings. We parent, we work, we love, we're good friends, we're good daughters, we're good sisters, and we're positive members of our community. But we need to show that to counter that negative stereotype, which in most of our cultures has been around for generations or for as long as anyone can remember. So supporting each other to speak out is the most important aspect. But also you need to grab a nation's attention. And so that you need some high profile campaigns that get those messages out widely, you know, across regions or towns or a group of villages, so that you start to make something that is negative and invisible positive and visible, like UNSC featured in the advertising campaign in the CRA and other champions. And then I think the other thing that we know from research is really effective as well is when those of us with lived experience are sharing our stories at events, whether it's a market stall, you know, whether it's as part of a sermon, so it's to a congregation, or it's part of a football club, that we're there physically with other people sharing our stories. And obviously during the pandemic, that's been a bit more complicated. So lots of those conversations have gone online, and you've both done that amazingly well. So we can do it online and we can do it in person. But what's really important is that we find our voices, and we might need some support, because it's, you know, it's still not something that everybody feels comfortable doing, because you might lose your job, or your future husband or partner be told not to go near you. So those are all the reasons to do something about it, but we have to do it collectively. So we can do it, you know, as women together, as men and women together, as younger and less young people together. You know, all of us have a story to tell. So I think that's the way forward. And it's really important because, you know, we're denied our basic rights and our opportunities in life. And that's just not acceptable, shouldn't be acceptable. So I've got a question. I think it's our final one, actually. And I think my question is to Essie, which is, what are the kind of existing platforms or networks that you could use to strengthen the anti-stigma work? What would you suggest are the kind of networks and places where anti-stigma work could happen?
Okay, so my first experience with anti-stigma work was with Time to Change Global, when he brought the project to Ghana. And then last year, because of the pandemic, we had to move everything online. So that's how I got involved with the project. But I think for anyone out there who wants to start their own anti-stigma work, there are lots of support groups online, both locally and both internationally. Like here in Ghana, we have an organization called Psychosocial Africa. There's Mental Health Society of Ghana. There's MEHSOG, Basic Needs. There's Hey Foundation Africa. Abroad, we have people like Time to Change Global, Sightsavers. All these networks are abroad. But as an individual, if you also want to start your own anti-stigma, I think the best thing to do is to start by getting informed. Do your own research online, because you can't go and talk about what you don't know. Read about mental health conditions, their symptoms. If you get the chance to speak to mental health professionals, take advantage of it. And I like, just get the testimonies of people with lived experience. Talk to them. You can watch videos online, listen to other people's experiences. It's to really, really make you really understand what these people are going through and how they've been able to overcome some of these things. Because if you start your anti-stigma work and someone meets you and asks you, okay, you said if I have a mental health condition, I can still thrive, I can still survive, what's the way forward? Then you can encourage that person. So that's why I use my YouTube channel as a platform, because I was all home and alone. I didn't know the way forward. And that's when I decided that let me just use my channel as a platform. And with Time to Change, every Wednesday we used to go on Facebook Live. We used to discuss different things and invite some of the champions over to the office to also talk about it. So those are just some of the ways. I just believe that if everyone makes a little noise about anti-stigma, does more campaigning, a lot of people will hear about it. It doesn't matter how small your voice sounds, but in the end, if it just takes your small voice to change one life, it is a big deal, because one life can change the whole world. Thank you.
Thank you, Essie. That was really powerful, and I really appreciate it. And I wanted to just say thank you to Sue and Cecilia as well for sharing. this really brilliant conversation. So my colleague Peter in Ghana was going to join this call, but he can't, and he was going to make a closing remark that I think is really important. He was going to talk about the role of men and boys and why it's so important that as women and girls, we work with men and boys to really bring about that gender transformative change that we want to see. We want to choose to challenge those stereotypes, but we don't want to alienate those around us. So those men and boys as part of our families, as part of our communities and wider society need to be engaged and involved in this too and support us. So on that note, all of us would love to wish you a really happy International Women's Day and go out there and smash it. Yeah. Thank you.
Bye.
Thank you.
Bye.